Good morning. Hi, I'm Raakhee Mirchandani, anchor and contributing editor at the trusted Dow Jones. And I'm so happy to be joined here today by Jörg Krütten, head of healthcare and life science at Simon-Kucher, to discuss how staying healthy has the potential to really change the healthcare industry. Welcome. Jörg, this paradigm is not entirely new, right? This idea that the focus on healthy habits and a healthy lifestyle as a means to minimize health risks. But why do you think it's something suddenly that people in the healthcare industry should be paying more attention to?
Well, first of all, thank you for having me, Raakhee. I would say that we see a completely different dynamic these days. On the one hand, we have new partnerships within healthcare, but also across industry verticals. We see new products being developed at rapid speed. I think the COVID pandemic has done its part to it. We, I think, have all learned how important prevention is. If we just look at the vaccine market, it has grown by 270% between 2019 and 2021. And we see, super exciting new vaccines that are about to be launched. So I think it's a completely different dynamic and, real transformation we are observing.
And when you think about it, right, as a business concept or a business strategy, where do you see the growth potential?
Well, in addition to vaccines, obviously, there are several categories that are interesting and offer great growth opportunities. If we just take wearables, for example, everybody will be able to relate to wearables. Devices that capture health data, that monitor health data, there's not only value in changing patients' habits, there's also huge value in making healthcare more personalized. It can inform unmet needs across patient population. It can inform clinical research and clinical decision making. Huge application areas for that. Another example would be dietary supplements. Vitamins, amino acids, minerals, a market that is growing by 7%. And we expect growth up to 10% over the next years to come. And what I find most exciting is actually recent discussions I had with payers. Now, been doing my job for over 20 years now. And whenever we talked about prevention, particularly in the context of diabetes management, always all the alarm bells went on. This is huge cost, uncertain benefits, not with us. I think that has changed. Payers are open to look at preventive healthcare, and if we just look at recent developments in coverage of obesity treatments, weight loss therapies, that is a completely new arena that has opened up, and with the support of payers. So I think there are many interesting areas to look into.
So you've outlined the upside, right? But where do you expect the industry participants are going to come up against obstacles or difficulties if and when they seek to execute strategies based on this broader philosophy around staying healthy?
Well, as always in healthcare, first and foremost, it's about really demonstrating value. And that's not easy when it comes to preventive healthcare. It is a function of having meaningful clinical evidence that really shows that availability of data, product, solution have positive impact on disease progression or disease prevention. But the other part is also, and this is what companies often underestimate, is besides the value, what is the use case for a technology, for data? How does it plug into patients' or consumers' daily routines? How do we find our place in patient management guidelines? So the use case is, I would say, equally important, and that also determines the amount of change that needs to be managed. The third area is obviously still convincing payers. That is not easy, as we know. And then another key aspect is, how do we monetize the added value of a solution?
Right.
Who pays? Is it the patient, the consumer, the employer, the payer? Who pays for this? Is it everybody to a certain extent? Or is there an opportunity for manufacturers to look at this as part of a holistic disease management portfolio and monetizing, via a portfolio play?
Jörg, for the folks here, right, looking at their own enterprises, their own portfolios, what's your advice to them as they consider capturing this growth potential that you've mentioned?
Well, I think the first and essential part is understanding really the value you deliver to all the stakeholders in the healthcare space. The question is who benefits, to what extent, and that basically determines your primary target groups. I think the use cases I already mentioned, that is something a manufacturer or supplier needs to proactively manage. It is not just making a technology available or data available. You need to guide providers, patients in effective usage. I think it's having differentiated value propositions for different stakeholders you are targeting, addressing different needs, different expectations, and I think that needs to go hand in hand with also having compelling clinical evidence. And this is where I feel that, let's say, non-traditional healthcare players have the mindset of, we only do as much as needed and don't see it necessarily as a key prerequisite for also getting funding and market access. And if payers don't pay, or you don't target, you don't expect them to pay, there's questions around exploring innovative monetization pricing models. And the last aspect is certainly defining an effective and efficient go-to-market that centers around the patient, and that also leverages digital marketing engagement or sales channels.
We'll have to leave it here today, Jörg. Thank you so much for answering this question so clearly and so concisely. I know you'll be around all day, so I'm sure folks can find you if they have additional questions. Thank you so much.
Thank you for the opportunity to be here and for the conversation, Raakhee.
You're welcome.
Thanks.